What did you do? What did you press?
There was a stop button at the bottom. I pressed stop.
You pressed stop and then what did it do?
I came up with this little screen and I didn't read it. I just pressed later because I thought it was something unimportant. Hi, Hal again. And I got the Nuss Procedure and I am just here to update everybody. So I've been wanting to do more updates, like I was gonna do hospital updates and stuff, but it was just a lot more mind-consuming than I thought that it was going to be. So now I am almost 2 weeks post-op. But let's talk about everything. I had pectus excavatum. My Holler index was 5.2. I talk about all this stuff in previous videos, so if you want to hear about symptoms and stuff, just go there. So I received the Nuss Procedure at Connecticut Children's Medical Center in Hartford, Connecticut, from Dr. Misra and Dr. Rader. Each of them have done at least 100 procedures before, and I had only heard good things, so I wasn't too nervous about it. I know that there were fellows and residents in there during the procedure as well, and I got to talk to everybody a lot beforehand and get all my questions answered, and then they kept visiting me in the hospital and checking up on me and answering more questions throughout. So it was a really good experience there. Everyone was great. Getting there, they called me the day before and told me all the instructions, when to stop eating, when to arrive and everything. So since I was staying the night, I guess that made my procedure later in the day. So I didn't have to arrive until noon. We got there at noon-ish and just kind of like hung out. We went and like checked in, and there was a lot of sitting around. And then we went to the pre-op area. It was just like a huge room. Everything was separated by curtains. They drew some blood and I had to get into like my gown and stuff. I just sat around. I had my mom and my partner there. I got to talk to the fellows that were going to be in the room and Dr. Misra and discuss anything that I needed to, and my family got to ask questions. It was good. I was in there for maybe like 45 minutes, and then when Dr. Misra got done with her previous procedure, we went in. Since I was in a children's hospital, my family was actually, one of them was allowed to come in with me until I fell asleep, but I didn't want that, so they stayed and they were taken to the waiting area, and I was taken into the room, went in, got up onto the bed thing, and then fell asleep really quickly, and I woke up. Anesthesia is nothing. You fall asleep and then you wake up. It took maybe 2.5 hours. I don't remember waking up. Apparently I was in a lot of pain though, and I just laid there almost crying with my family talking to me. For the next like 2 days in the hospital, I was just really, really doped up. I don't really remember everything. I had an IV. I don't remember what was in the IV. I didn't have an epidural. I had an on-cue pump, which just kind of like pumped numbing stuff to the like incision areas. Yeah, I had IVs and they were giving me all my meds through there. And I want to say like 3 or 4 days into my stay, they switched me from the IV to oral medication, which included OxyContin, oxycodone, Robaxin, which is a muscle relaxer, some anti-nausea medication, Tylenol, and I think maybe I was also on ibuprofen. That was rough. That was when everything kind of went downhill, because beforehand I had a pain level of like up to 4, and it was very tolerable. I felt okay. The only thing is I was dizzy, and I kept like dry heaving. but when they switched me over to the oral stuff, the dizziness was different, but it was tenfold. It was insane, and I was just like dry heaving all the time, and I got into a bad habit of not eating when I took my meds because eating made me more nauseous, but not eating when I took them made the meds made me nauseous. So then I wouldn't eat ever. So I was eating like half a sandwich and a couple graham crackers a day at the most. And just, I was extremely nauseous. I was vomiting. And that was the main reason I couldn't leave. My pain was, it was like, some days it got up to, I think 8 was like my max pain level. But it was 3 to 5. It wouldn't have even been that bad if I weren't so nauseous. The nausea was the worst part. So I got there on a Wednesday. I ended up leaving the following Tuesday. So it was just shy of a week. On Monday was actually my worst day. I was really, really nauseous. Everything hurt. It was terrible. But on Tuesday, I woke up. I made myself have a bowl of cereal, and I just felt better. And it was kind of just like, now is my chance. So I left on that Tuesday. And on that day, that's actually the first day that I felt up to showering, so I hadn't showered in about a week. Yeah, it was a pretty good day though. I felt alright. Besides the nausea, the only other problem I had was nerve damage on my right side. Something, I don't know, they said it was about how I was positioned during surgery. My right arm, as soon as I woke up, I noticed from my shoulders down to the tips of my fingers, everything was completely numb. It was like pins and needles. It was like that for much of my stay there. It only improved slightly. They had an occupational therapist and a massage therapist coming to help me out, but I was just like too nauseous. The first day that the OT lady came, she like was teaching me some hand exercises and giving me some clay to play with, and I kept falling asleep while she was there because I was too doped up. And then on the second day she came was that Monday, and I puked while she was there, so she left. I never got to see her again, and I have yet to be referred to somebody about my hand and everything. It has definitely gotten better, but it's just not there yet. The tingliness has gotten better. I can feel everything. It's just really my index finger and my thumb that are pins and needles, and then the top part of my arm is just numb. Everything else is okay, but all the muscles from down here up into my arm, they're just so sore and weak. I just can't do much with it, and it stinks because this is everything. This is my everything arm, my writing arm, my eating arm, and I've just kind of been having to relearn how to use it. It's definitely gotten a lot better, but it's just not there yet. That's my main complaint right now. My pain really hasn't been that bad since I've been home. The first couple of days were pretty rough. I wasn't really that nauseous. I've thrown up a few times since being home, but otherwise the nausea hasn't been that bad. When I take my meds when I'm supposed to, my pain is like, I don't know, 2 or 3. It's not bad, especially right now. It's like, it's fine. You don't really know your limits until it starts hurting, and you don't really want to get to that point. Breathing is tough. I can't yell, and I can't really take deep breaths. I've been using this spirometer, and they said in the hospital not to worry about how high you were getting it. You should just be using it. It gets your lungs moving, and it helps you from getting pneumonia and other lung problems. All you have to do is breathe out and then breathe in. I've been marking how high I can get. They said it wasn't a big thing in the hospital, but it's a big thing to me now because I'm trying to get my lung capacity back up because I really feel short of breath. I had some heart stuff that was happening beforehand that I really haven't been feeling much of now. I haven't been exerting myself, so I guess we're gonna see in time if I start to notice any changes. As of right now, I'm actually feeling really good. I will definitely post pictures at the end of this, before and after photos, and also of some incision photos. If anybody wants to see that, I'll do those last, so if you don't want to see it, you can just close the video after those. And I also want to talk real quick about packing stuff and things that are going to be very useful to you after surgery. Things that I would be sure to pack. You're going to be in a hospital gown for like most of your time there, but when it gets towards the end, you're going to want to pack sweatpants and button-up tops, ones that you can get on really easily. It's taken me a while to get into shirts like this that I can just like squeeze my way into and I don't have to button up. I would take a stuffed animal or a pillow, kind of just makes you feel more at home. It's also really helpful to be able to squeeze something on your chest, especially if you have to clear your throat or something, because that really hurts. I would take your own snacks, things that you think you might want to eat. I actually brought snacks that I never felt up to eating, but it's good just in case because you're going to have a really low appetite. Your laptop, your chargers, and your phone and everything. I was too sick to use my laptop. It made me feel really ill, but your stay could be different. Bring a journal. I couldn't use it because I couldn't write, but it could be really helpful to have if you want to document things, because it's very hard to think back and to remember how I felt those first couple of days because I can't remember any of that. My hospital had some wipes, but I would bring your own wipes. It's nice to just at the end of the day be able to wipe your face off and to just every day kind of wipe a different area and feel a little bit cleaner because you're going to be in bed often. I wanted to also mention, sorry I forgot this, I had a lot of lower back swelling and it got like bruised and stuff. Like it was very swollen because I was laying in bed so long. So try your hardest to get up and walk around and sit in the chair and just be in different positions because lower back swelling is awful. Also, it was a last minute thought, but I brought an electric toothbrush and it was the best idea because your mouth is going to taste gross. Between all the food and all the different meds, it's gonna taste really disgusting. And you're gonna have dry mouth for a while too. So bring an electric toothbrush because it's gonna be hard to do this movement. And the electric toothbrush saved my life. Coming home, make sure you have something to document your meds on. This whiteboard over here, I have all my meds written at the top, and then there's a line in the middle, and below that is all my meds for the day. So I write down like number 1 is my OxyContin and I take that at a certain time. So it's just good to document it because it's a lot of stuff to take when you get home. A recliner. I am in a recliner right now. This is one that a friend gave to me. My mom also bought one that's an electric one, but the one that I'm in right now, it's not electric, so I can't lift the leg part on my own. I really have just been putting a chair in front of me, so at night I just do that and then I put my legs on the chair, and it's been really comfortable. It has definitely helped with the edema in my lower back too, and finding different positions, and sometimes you might have to put like a towel under your lower back or under your shoulders. My partner has been here, they've stayed with me for 2 weeks, a week in the hospital and a week home, and they're leaving today, but they have just been a lifesaver and waking up with me in the middle of the night to help me take my medicine because I couldn't even open the pill bottles. My mom will be helping me out now. I'm going to be staying home alone now during the day. I think I'm strong enough to do a lot of things on my own. It's just things like cooking a meal I can't do yet because I can't lift all the pots and pans. And just twisting around and everything. But just know your limits and try to relax and take advantage of this downtime that you have. The recovery has looked a lot different for other people. I haven't really had the hardest time other than my arm and the nausea. The pain has been tolerable because I really built it up in my head, and it has been nothing like I thought. There are times when, if I'm sitting in a certain position, I get like a sharp pain in a certain area. Or when I wake up in the morning, it's usually really bad because I don't like waking up every 3 hours. So I go like 6 hours, and when I wake up, it hurts everywhere, and it takes maybe a half an hour for the meds to kick in and for me to start feeling okay. But that's, nothing. I think that's all I wanted to talk about. This has been a pretty long video, so I hope I covered everything. You can come to me if you have any questions. I had a lot of questions before the procedure, so I'm willing to answer anything. And if you are having this operation soon, good luck. It's going to be fine. I was literally terrified beforehand, and it's really okay. So good luck, and thanks for watching.